Did you know that vaginal dryness, burning, urinary urgency, or even painful sex are not just part of getting older? These symptoms can happen whether you enter menopause naturally with age or suddenly because of surgery or certain medical conditions. And today, we're breaking down what's really going on in your body and what you can do to feel better. Hi there, I'm Dr. Brooke Kalisiak, owner of Legacy Physical Therapy in St. Louis, Missouri, and a pelvic physical therapist who is passionate about helping people improve their pelvic health and feel comfortable in their bodies again and again. And today we are going to be talking about something incredibly common but rarely talked about, genitourinary syndrome of menopause, or GSM for short. What is GSM? As women age, estrogen levels naturally decline, but menopause doesn't always happen gradually. Some women experience menopause for various reasons, naturally as a part of aging like we just talked about, or surgically after hysterectomy with removal of the ovaries, or medically due to certain treatments or medications that suppress hormones. But no matter how a person arrives at menopause, the shift in hormones can lead to a group of changes that affect the vagina, the vulva, the bladder, and the pelvic floor. And this is collectively known as the genitourinary syndrome of menopause. So why does estrogen matter for vaginal health? Estrogen plays a vital role in keeping the tissues of the vagina and the vulva healthy. When estrogen levels start to drop, vaginal wall can become thinner and less elastic. Estrogen keeps these tissues thick, stretchy, and well lubricated. Natural lubrication starts to decrease, and this can lead to dryness, burning, or even pain with intimacy. We can see changes in vaginal pH with it rising. Before menopause, the vagina is acidic, and after menopause, it becomes more alkaline, which increases the risk of infection. We can see changes in vulvar tissue with it becoming thinner and more sensitive. The labia majora, the lips, and the clitoral hood may contract or thin out, leaving more delicate skin exposed and potentially prone to irritation. We can see weakening of the pelvic floor muscles. This may contribute to urinary leakage, urgency, or difficulty fully emptying your bladder. These changes are very common and they're treatable. So we want to figure out what you can do in your particular situation. Now let's talk of some of the most common symptoms of GSM that you may notice. Itching, burning, irritation, or chafing in the vulvar area. You may notice dryness and discomfort with penetration or even painful intercourse. I've had some women say that it feels like sandpaper when their partner is trying to slide into the vaginal canal. You may notice light bleeding after sex, and any bleeding is something that should be evaluated by a healthcare provider. You may have pain or burning with urination or even recurrent urinary tract infections. Some women start to notice persistent smelly discharge that is due to that increased vaginal alkalinity, and these are symptoms that should be dealt with medically. This is not just aging, and there's help available and things you can do. If you are dealing with vaginal irritation, here are some things you can do to help reduce it. Daily habits can make a big difference. Choose breathable cotton underwear or skip the underwear altogether at night to help those tissues get some air. Avoid really tight clothing, pants, pantyhose, tights, or staying in sweaty, wet workout clothes after you're done with your workout. Try using unscented laundry products and avoiding fabric softeners. Skip douching or feminine sprays or scented pads, as that too can irritate the tissues. Even tampon-wise, if you're still having a period, you want to think about using a natural option for that. Avoid shaving or waxing the vulva if that irritation is present at the time. And you want to think about washing the vulva gently with plain water only and patting dry instead of rubbing. These are all steps that can help to soothe irritation and support healing for those tissues. If you are dealing with GSM, there are several effective treatment options to improve vaginal comfort and tissue health. Just like we use moisturizer on our face, you might want to think about using a vaginal and vulvar moisturizer. Used regularly, these help to improve hydration and support overall vaginal health. When looking for a moisturizer, I do recommend trying to find one that has hyaluronic acid in it to help with the plumpness of the tissue. You might also want to think about vaginal lubricants. Water or silicone-based lubricants reduce friction and make intimate times more comfortable. Lubricant is your friend, and there are many good ones on the market. Here at our practice, we tend to use slippery stuff when we're working with clients, as well as recommend Good Clean Love or Uber Lube as other options. But lubricant is your friend to help reduce friction. Many women may benefit from the use of vaginal estrogen. This low-dose localized estrogen treatment helps to significantly improve dryness, irritation, pH balance, bladder symptoms, and even pain with penetration. So it's important to talk with your medical provider about whether or not vaginal estrogen is right for you. And the research has shown that it can be safe to use in the majority of women, but you should still be talking to your provider to see if it's right in your particular situation. Pelvic physical therapy is a great option. A pelvic PT can help you to learn to relax tight, tense muscles, maybe teach you stretching techniques or bladder training, and can give you personalized exercises and activities to help you reduce pain and improve intimacy and or bladder control issues. So in closing, if you find yourself dealing with issues of GSM, please know that it is incredibly common, but it's not something you need to endure quietly. If you're experiencing these symptoms, talk with your medical provider and don't hesitate to ask for a referral for pelvic physical therapy. I'm Dr. Brooke Kalisiak with Legacy Physical Therapy, here to help you feel informed, empowered, and supported through every stage of life. So if you found this video helpful, please like, subscribe, and share with someone who might benefit.
Thank you for watching our video. We hope you found it informative. We put out weekly content on pelvic health topics because we want people to be able to optimize their pelvic health throughout their lifetime. Make sure you like and subscribe our channel so that you're alerted when our next video becomes available.